Good evening and welcome to Your Health DeKoded. I'm Manika Raikwar and today we're checking to see if your vision's clear. Yes, we're addressing the growing concerns about eye health in our rapidly changing lifestyle. Your Health DeKoded and our viewers are very lucky that we have today with us India's leading ophthalmologists, two of them, Dr. Sudipto Pakrasi, Chairman of Ophthalmology at the Medanta Hospital, and Dr. Kareem Pakrasi, who's the Director of Ophthalmology also at Medanta Hospital. I hope I got the name right. I did practice it. Okay, Dr. Pakrasi, if I can start with you.
Yes.
You know, increasingly, we had a lot of viewers writing in, especially about children and how their vision is getting affected with phones and iPads and screens. If you could sort of generically, I know it's very difficult to control children nowadays with their phones and everything, but if we could speak to our viewers about certain conditions that parents can maybe lay out or an environment they can give which would help maintain or preserve eye health.
Well, the question may be very, very difficult for me to answer because, we have seen a sea change over the last many years. With the evolution of mankind, we have shifted from a far point culture to a near point culture. So, when we were growing up, it was just books. Today, everything is screens, right? So whether it's your cell phone, whether it's your iPad, your laptop, your desktop, your movies, television, whatever you have, all teachings are on screens. So a couple of things are happening. Firstly, most of these situations require the eyes to be open when you're looking at a screen. So fundamentally, we have an eye which blinks every couple of seconds to keep the eyes wet, right? So when the eyes are looking at something, staring, because you're watching something on the screen intently, we don't blink as often. And so there's a huge amount of dryness which is cropping up firstly. Secondly, the rapid changes and movement of the screens with everything just coming for a blink second, it is having a huge impact on the mental health of all the children. Third, I would say that it has become a problem where people come to us and say that my child is watching screens, please tell him that he should not be watching it, he'll go blind. I said, we can't do that because their life is based on the screens anymore. I mean, we can't say don't look at the screens. So it becomes a challenge because we have to now educate. Now, who do we educate? You'll see parents who are busy. A child is, uncomfortable. The first thing they say, here, take the phone and start playing some video games. Number two, they will always try and snatch the video games when they want to. So it is the parents' whims and fancies which they are letting the child either get or not get the screens. So there's a conflicting signal. Their mental health, as I said earlier, is also getting very, very toxic with all the nonsense which they are being able to see. So I feel that the myopia, which is a minus number which people used to not have so much, is becoming more and more of an epidemic with the environmental factors. And also it is getting increasingly difficult for us to actually tell parents what to do to take care of the health of the eyes.
You know, it's very interesting. He spoke about how screens are affecting eye health. But increasingly, we see a lot of young kids getting spectacles at a very young age. Is it only related to screen time? Is it something else? And what are the signs a parent can look for to sort of know that their child needs specs?
See, mostly when you look at close range, it is your near vision complex which is getting strained. Right. Okay, so that is something which gives rise to myopia in the long run. Because myopia is when you can see close and when you can't see the distance. Right. Okay, so usually myopia is genetic. So you can contribute to myopia by doing too much of close work, but it is not the only thing which determines it. Mostly what determines it is your genetic makeup. So if your parents have myopia, you are most likely to be myopic too. And what happens is when you're doing too much of close work and when you're holding things too close to your eyes, so your eye basically, it has a lens here, okay? So that lens is not static. It is constantly moving in order to change the focus from near to distance. When you look far, it becomes flat, like this lens, okay?
Right.
When you look far, it becomes flat, and when you look near, it curves. So this is contributed to by this elastic which is around the lens. And that elastic, when you're looking too close, too long, it becomes tight. So sometimes that can contribute to an increase in the myopia, but it is not true that you can get myopia by looking at the screen.
Right. But it's very interesting. You and I were talking earlier, and you spoke about eye exercises, and sort of there is also this whole thing of, as you age, you'll get glasses, right? Almost everyone gets reading glasses. And you said, well, that's not true, because like a lot of other organs of our body, why don't we exercise our eyes? So speak to our viewers a little bit about that.
So, this is something that Sudipto and I always, encourage our patients to do, is that to resist that urge to just give your eyes that crutch, When you get closer to 40, so your muscles, which is that elastic band, which is holding your lens in place, okay, that band becomes a little lax. So people who are myopic, they'll find that means they have a minus number, they'll find that their minus numbers are going down.
Right.
Okay. And people who never had a number to start with are getting reading glasses which are plus numbers. So basically it's the plus and the minus cancelling each other out. Yeah. So it is to do with that muscle. So to some extent, if we wear our reading glasses, we get dependent on that shape of the lens. So we can no longer go from that relaxed state to the contracted state. It becomes more difficult. So that's why we tell people that as long as you can manage to keep those muscles, the ciliary muscles as they are called, exercised by avoiding reading glasses and by making that extra effort, of course, as long as it is not giving you headaches.
Right.
And if you remember not to frown, because nowadays, the frown lines are a big thing. So we don't want people to strain to that extent where it causes them frown lines or gives them headaches, or it can even set off a migraine. So if you can do it within a certain extent, then I think it's a good thing to be able to manage.
I also want you to speak to our viewers about that very interesting story about how you told a patient wear a lens in one eye one day and then wear it in the other eye the other day, and sort of, don't get dependent, and it'll help. So tell us about that.
So the story is like this: when you give a -1 and you are 50 years of age, you can read nothing here because you need the further near add. So if you don't wear anything, then you focus with your eyes not there, but you can read here. So if you are not wearing any correction of -1, I can read everything here. The moment I put on a -1, I can read everything there, but I can't read this. So what you do is, we used to do this for our surgeries called monovision, that you correct one eye for distance, the other eye is corrected automatically for reading. So if I put a -1 in one eye and not the other, this individual could see there, here, without glasses.
So it's a great combination without.
It's a typical Indian word called jugaad.
Jugaad.
No, and actually in LASIK, people who get LASIK done, if they're anywhere beyond 30, they give them this correction post LASIK. They leave one eye slightly undercorrected.
Right.
So
they don't correct it fully, because then the moment you touch 40, you can't read anymore. Then there's really
I want to discuss LASIK further, but before that, I want to know, for instance, when you don't have any problems growing up or whatever, you really don't go to an eye doctor, you don't go to an ophthalmologist, you don't go to a dentist. But as experts in eye care, what would you recommend? When should people start going to an eye doctor? How many times a year? Like just some guidelines so that, we can maintain eye health.
So, basically every country has a set of protocols.
Right.
So different countries follow different protocols, but more or less across the board, when a child is born, the pediatrician has to look into the eyes and make sure that the pupils are reacting equally in both eyes. That immediately gives you a sense of whether light is entering the eye or not. Generally, we will just not do a proper evaluation until, like, say, some people, if they have myopia, if the parents have like some, refractive error, as we call it, then they are concerned that, oh, my child might be having a refractive error. So we can do like just a quick check to see if there is a refractive error, just to make sure that everything is okay. But really, when they go to school, that is, once they are able to read, then we say, okay, this is the time. If they have glasses, we will give it to them. Before that, all that we can do is do that test, which is an objective test, just to see if there are showing any variations in the, the normal parameters that should exist.
Right.
So then, of course, at age 4, you check them, and if once they're able to, and nowadays even children at 3 also, they can say apple, orange, and there are different ways in which you can check it. So you can make out. So if you have like a family history of, maybe a high refractive error, then you want to do that when they're, younger too. And there are ways that we can do it, but there's no need to go like crazy about it. Because if there is a refractive error, the same thing will happen. Because if you don't expose the eye to the good images, then it gets something which is known as deprivation amblyopia. Amblyopia is basically a lazy eye.
Oh.
So you get a lazy eye, and you'll be surprised the number of people who just go through adulthood without even knowing that they have
Does it not show? Isn't a lazy eye almost like a droopy eye?
Right.
No, it's not. No. Okay.
Essentially, what her summary was, that you need to look at inside the eye for any white reflex. It could be anything from a hemorrhage to a cataract to a lesion in the retina, in the optic nerve. It could be a tumor, it could be a retinopathy of prematurity. So the moment you get that reflex, you have to be on your guard much more than what normally you would do, and make sure this child is referred immediately to a pediatric ophthalmologist, or even any ophthalmologist, whoever is available, so that we have to detect it. If we don't detect it,
actually this is a very important
deal with
message.
blindness.
Early detection.
Correct. I think 6-monthly examination is very important till they become about 3 to 5, after which probably a yearly examination is on the cards. But if they have glasses, what we do recommend is every 6 months, if they could come back for an examination till they become teens. And during teenage year, there's a sudden growth spurt. And this growth spurt is due to the growth hormones, which also increase the length of the eye.
Oh.
So we have a lot of people who may have a very little myopia when they are in their 6, 7, 8 years of age slot.
And that suddenly
at 11, 12, with the hormones acting in the system, they become taller, their feet size become longer, the eyes become longer, myopia becomes more. This process may continue from the age of maybe 11, 12, as the puberty happens, till about 18 to 21 in children, right? This is one of the main reasons why we do not like to do any LASIK, the refractive procedure which you had just mentioned earlier, before their full body growth has been established. Then after that, if you are looking at young individuals beyond 2021, if they have myopia, it's recommended once a year they have to get checked. Myopia means number of -4, -5, -10, whatever. If they have no numbers, maybe once every 5 years is good enough. But after the age of 40, between 40 and 50, no problems. Get checked for things like glaucoma once, because it could be inherited. There are no symptoms of glaucoma. I think we should be talking about it later. But if you're able to detect all these issues at 40, yes. But if there is absolute normal examination, which has been done at 40, you may even go after 5 years or 10 years, right? But after 60 or 65, especially if you have diseases like diabetes, you have a known macular degeneration, in the family, you have a known retinal detachment, which is, there in somebody in the family, it is very important for everybody beyond 65, ideally 60, but 65, to get an annual evaluation done.
Right. So I actually now want to touch upon LASIK, and we're going to come to glaucoma as well. You know, my son got glasses when he was about 7, and I think it took him some time to kind of, you know, get used to the idea of glasses, because nobody else in the family had glasses, or even has, like now I have reading glasses with. And I think during his teen years, he kept telling his ophthalmologist that, you know, why can't I do LASIK? And she said, absolutely not, you know, till he's 23 now. What would you recommend to, let's say, a young person who's sort of, you know, 23, 25, the pros and cons of LASIK?
Yeah. So, see, the thing is, LASIK is now a perfectly acceptable way to remove glasses. Yeah. But there are some very non-negotiable terms. The first thing is that your number should be stable. Because, you know, when we are doing LASIK, so
when you talk of stability, what is the period you're looking like? For it's been stable for how long?
Maybe at least for 3 to 4 6-monthly visits.
Okay. For how many years? Like,
See,
no. So if a person's
normally,
number is stable for a year, they can get LASIK.
They
Yeah.
could, yes.
Okay.
But you know what is again a surprising thing with you know what is theory and what is in practice may not really match. We've had people even at 25, 28, 35, 40 with changing numbers.
yeah. So
Wow.
that
So there
is
is no
because
fixed time. It's a question of your examination, because a lot of other factors are involved also.
Correct.
So even though LASIK, as she's saying, fantastic, it's one of the probably the most successful cosmetic procedure in the world, but it is not something which is there for everybody, right?
It's
Yeah.
so interesting
Yes.
that you call it a cosmetic procedure
It is.
and not sort of,
no,
you
no,
know,
it is
yeah,
definitely a
yeah.
cosmetic. And see, the thing is that the reason why I say there are some non-negotiable terms is that if you remember, he said very specifically that basically myopia, which is a minus number, which is why the reason why most people get LASIK done is to cure myopia. Okay, it's the easiest thing, like it's the easiest thing to do. So basically myopia is due to, if you remember, he said your eye growing longer, like your feet grow in size. So your eye grows long. So you're not going to change that process. The process of growth is not going to change. So if your number is not stable, it means that either your muscles are being overstressed or your eye is literally growing. And that is not what you're addressing. What you're addressing is basically the cornea, which is stable.
Right.
And you are treating the cornea, basically the cornea itself is like a sandwich. Okay, it has many layers. So very broadly, you have an upper slice and a lower slice and a filling in between with butter on one side, you know, whatever. So you're cutting through the upper slice and you're decreasing the filling. And see, if your number today is a certain number and you've, you know, made that cornea thinner by that much, and if the eye grows long again, then, you know,
It's back to square one.
you're back to
So
square.
just to
So which is
summarize,
why, a lot of people say that they got the surgery done, but
Right.
then after like some years,
Correct.
it was back to square one.
Correct.
Yeah.
so just to summarize what she said in a slightly plain language. So we are burning the cornea.
reshaping it.
The way I shape my lens, that same shape is going on the cornea, kind of, so that, like, you know, you're able to understand what we are talking about. So it is no rocket science. It's just you reshaping it. You're putting the cornea, not a contact lens, not a spectacle which is in front of it. You're just reshaping this. So once you reshape this, it is gone. It is changed for life. It cannot be undone like a lens you just chuck.
Right.
Contact lens, right? So once you do this, it should serve you for the next 25, 30, 35 years. Many years ago, when we used to operate on the cataracts, any surgery done here had a problem in trying to figure out what should be the power of this lens which I need to implant. But all those we are over with now. We have, I mean, the technology has seen multiple things which now do not affect the power of this lens calculation with what we have done outside. So in a nutshell, I think there is a huge space for LASIK. And one thing which you have not asked, I am sure you're going to ask it, the different kinds of LASIK, like contour vision, like silk, like you have the, you know, the smile procedures. Now, there is not too much of a difference between these. Actually, each of these have their own people who propagate them, but there are also people who negate them. So I think it's a win-win situation. Most of them work very well.
So the idea is when you go to your doctor, discuss it properly. Just don't go and say, I want to get it done and get it done.
So I feel that most doctors, nearly every doctor is very ethical. They will give you the right advice, and it is important to have this discussion properly with the surgeon, and every aspect should be known. You shouldn't just say, oh, my neighbor got it done, my friend got it done, let me go. Think about the consequences of what you're going in for, because these are not things which are reversible.
Right.
They can't be reversed.
Also, there is an age group. You see, so 20 to 35,
What?
you actually 40, but I will say 35, because when you're getting closer to 40, as we discussed, that your number changes.
Yeah.
So your myopia will anyway come down. So your number is again not stable.
Now, just to point out, Manika, that number is coming down not because of this, but because of that change here.
It's a different reason. It's no longer your eyeball growing long. It's now your lens aging.
Right.
So, but still, and sometimes we'll find people who come to us who have had a number of -2 just before 40, and then they've got LASIK done and they've lost the whole advantage of having that -2, because actually if you have a -2 and if your lens becomes relaxed, you may go down to a -0.75. Then what are you getting LASIK done for?
So moving on. We spoke about glaucoma.
Yes.
Again, something that at least one didn't hear when one was growing up
Yes.
many 100 years ago. But now it's kind of again become something that's very common. Maybe it wasn't spoken about. Speak to our viewers about what it is and when does one start need to test for it?
So see, the thing is, glaucoma has been
Around forever. Yeah.
It is a condition in
Yeah.
the eye. A lot of people just grew blind from glaucoma because you don't know that you have glaucoma unless you check for
Right.
glaucoma. So there are basically two spaces in the eye. Okay, there's a posterior space which has the vitreous humor, and the anterior space which has the aqueous humor. So this is related to the anterior space. Okay, so the fluid basically is anything that is alive has to have a constant circulation.
Right.
If it's not circulating,
Yeah.
it doesn't work. Okay, so there's a fluid which gets manufactured and then it goes through from here and comes to the front space, and then from there is a kind of a drainage process by which it leaves the eye. Okay, so you could have like a kind of glaucoma where that space itself is closed, which has a completely different presentation, and then you could have a kind of a glaucoma where the space itself is open and the channels are blocked, much like a tea strainer.
So how does it present? For instance, if my eyes are perfect, everything is fine, but I have it.
So,
like you said, I go every once in 5 years. What do I check for at home?
so if
to
you
realize?
have the closed angle glaucoma, then it will present itself.
As what?
You will get headaches in the morning when you get up, and your eyes will be red. And the reason that happens is because when you're sleeping at night, your muscles relax and they go and they block up that space further. You already have a narrow space, it gets blocked up. And then you wake up feeling like, you've got a strain and all of that. Yeah. So that is a sign. So it will send you to the doctor. But if you have open angle glaucoma, it is so innocuous that you'll never know.
So then after a certain period, I suppose after 20, 25 or even earlier, I should go
40.
And after 40. Okay. And does it happen in both eyes simultaneously?
It may not. No.
But
Very,
so
very
one
rare.
eye could be damaged and the other one could still be
But
functional.
the much worse thing is an open angle, but this is not closed. Now, the problem with open angle is there are no symptoms.
Yeah.
Zero.
Yeah.
So people live their entire lives knowing nothing, and we've had patients who can just probably see like through a tube. They've lost everything. They're not aware. There are no symptoms.
Because they don't go for that.
So they
one
don't
test.
go for that. So coming back to your question, when should they
A
check?
regular eye exam will not catch
Will
it.
catch it.
Oh, will catch
That's what I'm saying.
Huh.
That is why it is so crucial to
Right.
make sure at 40, especially
Right.
if you have a family history of glaucoma, go earlier.
Yeah.
If you have those changes in the scanning go earlier. But if you are a normal individual with no family history and none of these predisposing factors, make sure your eyes are checked around the age of 40. Give and take a few years up and down.
Yeah,
It doesn't
that
matter.
one test
Should
is
be
very
done.
important.
Yeah.
Right.
Anybody can figure it out.
Yeah.
But the point is, people don't go because there are no symptoms. If you don't
Yeah.
have fever, you don't go to the doctor.
Yeah.
Because there are few
So
things in it.
once it is treated, then the person is fine.
No.
Does it mean it can
No, no,
come
no.
back or
No.
like?
No, it's an ongoing. It's like diabetes
the-
or blood pressure.
Oh, so it has to be maintained.
The problem is that, if you lose something,
Right.
you get fever, pop in a pill, whatever the cause, it goes away, you're fine. In this situation, if you already have had nerve damage, it doesn't reverse.
Right.
One. Two, it is not something which you can get back what you've lost. So for you to say, I will treat myself to regain whatever I've lost is never happening.
So you're just salvaging what is left.
No,
So
you
it's
have
a
to make sure you
preventable thing.
prevent the future damage
Right.
by awareness, by regular, visits to the doctors, pressures being checked. If you're on treatment, your mainstay of treatment is to prevent further damage. It's a very complicated, complex thing, but in a nutshell, I would say that people are not aware. It is called the sneak thief of vision. It takes your vision out like dimak, like termites. It
Right.
eats away the damn nerve at the back, kind of.
Yeah.
Sorry,
No,
sorry
no,
to be
that's-
so gross, but I mean,
No, it's okay. Anything that gets people going to their doctor and
yes.
sort of, preventing
I'm
from
not
them
trying
to
to
go
scare
blind.
somebody,
Yeah.
but just
No,
to give
but
an
yeah.
example
Sure.
that it is not reversible.
Yeah.
So
Yeah.
it's preventable. So that's the difference in the management.
So from glaucoma to cataracts. Now that's again something that beyond a certain age, almost everyone's getting it. What is it? I mean, everyone keeps saying cataract. I had to take my mom, I had to take my dad, I had to take, whatever. And it's become a very normal thing now. Like everyone has it, get it operated, move on.
Yeah.
So again, what is it?
So he's the cataract specialist.
Yeah.
So let's
Yeah.
ask him to weigh in.
So is everyone in life going to get it? Like, am I going to get it in the next 10 years?
Okay.
Mostly.
Really?
Not really. I would probably.
You'll get changes in the
You get
lenses,
changes in
which
their
are
lenses.
aging changes.
We've had people who are more than 100 years of age with a clear lens. We've had people rigid lens but clear. We've had people who are in their
They probably never
10s.
used a smartphone in their life.
No, it's not linked to that.
Okay.
It's just the clarity.
Okay.
Like, do you have that other open one?
No.
It was brought in a bag.
You'll be surprised
So
to
this
know
is to be
that
clear.
even smoking can cause cataract.
Yeah.
Wow.
So
To all the
Which-
smokers out there,
so
beware.
So if this is the lens, this is clear normally. So if I may use this pen, the light goes from here back to the eye, right? Now, if you have this fellow here, it is blocking everything. So this is, if I can explain to you, like you have got an egg which you have put on a frying pan and very slowly turn the heat on. Very low heat and very gently it's heating up. So what's going to happen? This clear egg white will become maybe slightly turbid, then more turbid, then it becomes cloudy, then more cloudy, then becomes a boiled egg and completely white.
It's basically
So
the
that is the way
proteins
the
which
lens,
get-
the lenses change over aging, because this is inside the eye and all the metabolism, etc., is happening there itself, and that's a rule of life. So even though that accommodation was such an efficient process of seeing there, and suddenly the lens changes, we see here. But now with this aging, this becomes opaque, so the light doesn't go through. So if I change your glasses outside, again the light will be blocked here, so it doesn't work. So either you live with that poor vision, because you never know, because every day you're seeing little amount coming down. So somebody may have a cataract for 10 years, 15 years, doesn't know about it. They come to us, doc, what do I have? You got a cataract. I don't believe it. I can see
Yeah.
everything. Because they don't know. Till you show them the pictures, even then they say, oh, I can see everything, which I don't deny them. But till they get one eye done and one eye is like this,
Then they realize the difference.
then they see the difference and then they realize what's happened. But that's not our intention. Our intention is to just show to people and say, this is what you have. You're here because of this. Solution is surgery when you want.
So you said that smoking can also cause cataract. So, quick things. 5 things that we should do to retain eye health, and then I'm going to come to you to say 5 things that we shouldn't do.
Yes.
So 5 things we should do.
5 things we should do.
Including food, habits, everything. 5 things to do.
Yeah, so there has been a lot of research which shows that there are certain nutrients which delay the aging process, So basically your beta carotene, your fish oils, your green vegetables, all the yellow vegetables like carrots and pumpkins and all of that. So your nutrition is very important, and protecting your eyes from the ultraviolet rays is very important. So because you see what the lens does is it protects your retina from the ultraviolet rays that are around you, okay? So what it does is it absorbs all the ultraviolet. In the process of absorbing, the proteins get changed, and that is how you get. So that's why you find the incidence of cataract in people who work outdoors, like farmers and all, is more. They get it earlier. They get it early. People who live in the hills, they like Leh Ladakh, they get cataracts much earlier. So obviously wearing sunglasses, and the thing that you should do is protect your eyes from normal, like for example, even if you're sitting in a room, you need to always have like a backlight and these indirect ways of doing that. So can you think of anything more of the things that we need to do?
Lots. She's at 5 points.
Yes, tell me.
Quick, simple, that everyone can sort of,
Well, I think you've covered
Cataract.
it. You have to go for you have to go for a routine examination
To prevent.
essentially to do that. And so what I'm going to say yes to her is my point of we're not doing stuff.
Yeah.
It's like not going for an eye checkup.
Okay.
Right? Not sort of not being aware of what's there in your family, in your genes, etc. Like some people have glaucoma, which you just had a word. Some people have retinal detachments running in the family. Some people have myopia running in the family. Some people have, like genetic problems which run in the family. So there is no genetic counseling. There's no sort of follow-up. So these guys do not go for checkups at all. So that's the first thing which is a no-no. Number 2 is to actually sort of, keep working on computers all the time. And there is a computer vision syndrome or the dry eye syndrome, which is something which we really need to talk and discuss about, because the more we are staring at the screens, we don't blink at all. And that dryness is creating a lot of problems, giving the eyes a serious amount of abrasions, dryness, itching, irritation, discomfort, foreign body sensation.
Yeah, everyone's now carrying eye drops all the time.
The eyes go red, and then the third problem is going to any chemist and getting stuff like steroids. They call him Doctor Saab, just dawai de do. He will give you a steroid
That is the most important.
More often than not, they're going to give you a steroid drop, and you're going to put it and say, "Wow, this guy is so good." But that is going to destroy your eye. You will get cataract, glaucoma, so many other stuff which can happen due to steroids which are just used randomly because we do not have prescriptions here. The next would be, I would say, if you continue to abuse your body by not controlling your diabetes and just never sort of, getting the diabetes checked and the diabetic retinopathy, which is blinding you, which is another 1 or 2 things which you really have to discuss maybe another day. The diabetic changes in the retina, the age-related macular degeneration changes, the dry eye syndromes, all these computer vision syndromes, they have another probably session. But there's another thing which people should avoid, that they are just not looking after themselves. Then I would say...
what about things like smoking and drinking and,
Yeah, drinking, smoking, there is a connection, getting early cataracts, which is
There's
really
no
treatable.
direct cause effect.
I won't say a direct
relationship,
No,
but
no.
Because it is like they say, take antioxidants.
Right.
So that you can prevent cataracts. So this kind of decreases the oxidative capacity.
One common last thing which I would like to mention, which is universal, is even we have been sort of made to do it forcefully as children, is the age-old Indian practice ki aankhon mein pani ke chhite lagao.
Yeah, that is...
This is a disaster because we do not drink the dirty tap water, 1. 2, that lubrication, which is, like they're lubricating, which is already affected with the pollution, with the dryness, with the air conditioning, with the computer vision syndrome, that is getting washed out of the eyes. So you're not helping the eye by putting water. You are actually making it much worse. You're injuring the eyes, and this is what we've done all our childhood, because our grandmother used to strip with a stick.
आँखों पे पानी डालो.
Yes, छींटे मारो.
Because the tear film.
Okay, so last question. Now India is sort of considered the blind capital of the world in so many ways. We have a lot of blind people, children born blind. As leading eye doctors, what would you like to say about eye donation? I know it's up from what it used to be in the past, but how do we encourage more people to donate their eyes, because it could help so many others?
So we get a lot of people who walk into our clinic and they are concerned that, I've had cataract surgery, can I still donate my eyes? Yes, you can, because as long as your so basically the part that is important in eye donation, like people have a misconception that you donate the entire eye. That's not true. Whenever anybody goes in to collect, tissue for an eye donation, they only take the front of your eye. They don't take the whole thing. You don't, we only use this part of it. Okay. So even if you have any problem in the back of your eye, or you've had a cataract, of course you've had a LASIK, then you can't. But because, that means that your cornea is damaged, or if you have a cornea damage, then you can't use your eye. Otherwise, anything else you can. So, and nowadays I think they have a pretty well developed, you had organized.
And it's unlike livers or other organs, there's no match. Anything can be put in.
The biggest problem about any transplantation is the rejection by the body.
Okay.
And I think the corneal surgeries have really come up in the last 30 years, 35 years, immensely from what it used to be earlier. So today, I think the need of the hour, and as a lot of Indians still believe that if you donate your eyes in your next birth, you will be born blind. Well, we have to take some guidance from, somebody to say that it doesn't work like that.
Yeah.
So a lot of people do donate their organs in their bodies, and I think eye donation is a movement which, if you can, I think it's going to help a lot of blind people who are very poor by and large.
Yeah.
They can't afford it.
Thank you so much. I think that's a lovely note to end on. Thank you so much for coming to deKoder today. Dr. Sudipto, Dr. Kareem.
Pleasure.
This was wonderful and so sort of, I think our viewers will realize that there is so much we didn't know about eye health and we need to know. So thank you again for joining us on Your Health DeKoded. See you next week.